Tuberculosis is a bacterial infection caused by microbacterium, which medical experts say affects the lungs and can also affect other parts of the body. Reports show that a small proportion of infections progress to active disease that, if left untreated, can be fatal. Doctors say most people infected with the bacteria that causes tuberculosis don't have symptoms. Preventing this infection and reducing deaths from it is a focus today. And Dr. Olushola Shokoya, Director and Program Manager, State Tuberculosis, Leprosy and Buruli Ulcer Control Program Unit, Ministry of Health, Lagos, who joins us via Zoom, will speak to us. Dr. Shokoya, thank you so much for joining us on Insights.
Thank you very much, Elizabeth.
Thank you. All right, talking about
Nice being
TB,
here.
how does this affect the human body?
TB, of course, TB is an infectious disease. Is one of the most infectious killer disease, um, even worse than COVID-19. It gets into the body through the lungs, through inhalation of infected person with air droplets, then it enters to the lungs. From the lungs, it goes into different parts of the body. And once you have the infection in your lungs, you start having some signs and symptoms like having cough. Not all cough is TB, of course, but if cough is more than 2 duration, you're having chest pain. Then from there, could have coughing out blood, that's hemoptysis, and then you could also have fever, low-grade fever, then having weight loss. You realize your weight, maybe you are size 10, now you are now size 8 or size 6, or maybe you are size 14, you are now size 10, 12. So, and then you have night sweat, you are sweating in the night profusely. So when you have those symptoms, it's better for you to consult your doctor, either in any of the general hospitals across the country or a PAC or a selected private hospital designated for those center in the country.
In the country. Okay, we understand that there are two types. We have the active and the latent. Could you explain to us medically how these types work?
Okay. Now, because TB is an infectious disease, you get it through, it's airborne. So most of us, if you check the lungs of virtually all Nigerians, not only Nigerians, everywhere, everybody, two-thirds of the what population have TB in their lungs. And when there is in their lungs, it stays in the lungs and serves as granuloma, is embedded in the lungs without any visible signs and symptoms. TB, microbial tuberculosis in your lungs, but you don't have the signs and symptoms of it. It is TB infection. But when you have the TB in your lungs and you also have the signs and symptoms I just highlighted earlier on, cough, chest pain, weight loss, night sweat, hemoptysis, coughing out of blood, then we call that TB disease. Now, TB infection, we all have it. Most of us, two-thirds of the population in the world has it. But because our immune system is good, we eat good food, and because we are eating good food, good nutrition, we now have we build up immunity against TB disease. So that's why the TB infection in the lungs does not multiply to now become TB disease, to become start having signs and symptoms. Because of that, um, we have, that's why it's even from TB disease and TB infection. When you have the
Okay.
tuberculosis, microbacterium in your lungs, without signs and symptoms, it's called TB infection, latent TB infection. Now, when you have the microbacterium tuberculosis in your lungs, with the signs and symptoms like cough, hemoptysis, chest pain, and so on, then it is called TB disease. Most of the population have TB, latent TB infection in our lungs, but we don't have TB. But what we are talking here today about today is TB disease, when you have the TB microbacterium in your lungs and also have the signs and symptoms of tuberculosis, which is TB disease.
All right, Dr. Shokoya, explain to us at what point do we say it is severe?
Okay. When TB, when the point of where we say TB is severe is based on based on the extent of damage to the lungs. If there is uh, bilateral tuber damage, you have damage, you have opacity in the lung. Now, if you have cavity in the lungs, in any of the lobes, we say it is severe. Cavity is as a result of the antigen antigen response reaction in the lungs, resulting into a cavitation. Those cavities, if you have it in the lungs, it is regarded as being severe. Then, if the two lungs are involved with the cavity, you have bilateral involvement of the two lobes of the lungs. You have two lobes in the lungs. It's affected. Then you say it's severe. Now, we also have another severe form of TB, which we call drug-resistant tuberculosis, where you have resistance to the first-line drugs we are using for treatment of TB. So if you have resistance to the first line drug, then you will be moved to the second line drug. The first line drugs are inflammasine, isoniazid, pyrazinamide, and ethambutol. Any resistance to any of them, you will move to MDR-TB, DR-TB, drug-resistant tuberculosis. Those are the three times you will have TB to be very severe. Thank you.
Okay. So who are those at risk?
Those at risk. Wow. Now, for those at risk are those one, the poverty is a risk factor to developing TB. Those if you are poor, you are more likely to have TB. I didn't see. I'm not saying the rich cannot have TB. The rich can also have TB. Once your immune system is down, you have TB. But poverty, poor people are more likely to have TB. Poor ventilation and poor overcrowding will make you have is a risk factor to developing tuberculosis. Dirty environment is also a risk factor to develop tuberculosis. Um, um, Immune system, HIV, anything that reduces your immune system, like diabetes, hypertension, Hodgkin disease, leukemia, all diseases that reduces your immune system will make you have tuberculosis. Now, of course, TB is also very common in the extremes of age, the, the children and the elderly. Now, males are more likely to have TB than female compared to HIV, where females are more likely to have TB than the male. Those are the
Okay.
risk factors. Those are
Could you
the risks.
explain?
People are
Could
the
you
risk
explain?
having TB.
Okay. Could you explain to us why men are more at risk than women?
Men are more at risk to having TB disease as a result of the fact that the work we do as men, we take more risk. We are the ones that goes to miners, they hard labor. We work we work at dangerous work. You see the men working in as a miner, see the men working at asbestos company, and the men are more likely not to assess health. They don't take their health serious. So before a man goes to the hospital, it would take his time. But women go to the hospital, most likely they don't have the disease. They would have done, they have gotten access to health before that time. And the kind of job men do generally, we are prone to have TB. And we find men outdoors generally. Men are everywhere. So that's why, and disease is airborne. So that's the reason why men are likely to have. I'm not saying women does not have TB. Women also have TB. But in our data, in our statistics, we realize that more men have TB than than women.
All right. Just to say, women are more careful, generally. All right. There's a common
Um,
practice. Yeah, of course. All right. There's a common practice. When you meet someone with TB, or they tell you, "Oh, this person has TB," people run away. Can someone contract TB from touching or using the same utensils or sharing clothes or staying in a
Okay.
room with that same person?
Okay. Now you can't. TB is an infectious disease, of course. If someone coughs, someone infected with TB coughs, and you were there, if the air droplet comes in contact with your hand or with your body, you can, and then you put your hands on your body into your mouth, then you may have TB. If you are in the same room with the person with TB, um, the person coughs or sneezes or talks, and the air droplet get in contact with you, of course you can have tuberculosis.
Hmm.
However, you cannot have TB by sharing
Utensils.
plates, utensils. You cannot have TB. Now, TB is a disease of stigma. This is one reason why I'm here today, to let you know that one of the bane of our problem, where we are still struggling with the control, eradication, and elimination of TB, tuberculosis in Nigeria and the country at large, is as a result of stigmatization and discrimination. Yes, TB is a disease of stigmatization and discrimination, but TB is just like hypertension. TB is just like diabetes. The management of hypertension and diabetes, the treatment is for life. We have people with hypertension, we have people with diabetes that they live long life. They can live in 50 years, 40 years. Their 90s, their 100, still on hypertensive drug. No
Hmm.
problem. But why are we stigmatizing against someone who has a disease that is preventable, a disease that is you can cure? Just taking our drug for 6 months, you'll be okay. 6 months, just take our drug. In fact, the first 1 month will be okay. But take all the drugs for the next 5 months so that it will totally eradicate from your body. So why stigmatizing someone who has a disease that can be cured? The diagnosis and the treatment of tuberculosis is free in this country. So, and it is preventable. When you want to prevent it, you use TPT, tuberculosis preventive therapy. And then if you have the disease, we give you the first line drug for 6 months, and you are cured of it.
Talking about prevention and management, from the point of a medical doctor, what tips would you give on prevention and how is this disease or infection managed?
Okay. Now, let me start with prevention. Now, if you are in contact with anybody with tuberculosis, maybe your dad, your mom, your sisters, your siblings, any of your relatives are TB. Now, if you live in the same house with the person, it's better for you to prevent you having it. For
Mm-hmm.
example, your dad, your mom, your sisters, your siblings, they have TB. There's no big deal. So what we need to do, we do what they call contact tracing. Contact tracing. We come to your house, ask some specific questions about tuberculosis to rule out tuberculosis in others that does not have TB. The person that has TB, maybe the dad has TB. The children, the wife, we ask them questions. If they don't have TB, then we give them drugs to prevent them from having TB. Remember, prevention is better than cure,
Cure.
so that the father will not give the other children and the wife. So we do that, we prevent it. It's for prevention. And we have drugs, we have different kind of regimen. We have over four of them. We have the one we give for 6 months. We have the one we give for 3 months. We give the 6 months is daily dose for 6 months. We have the one we give for 3 months. And it's a daily dose for 3 months. And then we have the one we also give for 3 months. Daily is a weekly dose for 3 months. And then we have the one we give for 1 month. And that's one is given daily dose for 28 days, 1 month. Now, depending on different age group, different classification, different uh, exclusion criteria for you to take different regimen.
Does
Thank you.
vaccination play a role in all of this? Talking about treatments.
Yes, yes. Now, all of us, yourself, myself, even children that just gave birth yesterday had TB immunization. We call it BCG. But the BCG is not enough to confer long-lasting immunity against tuberculosis. We are having clinical trials. We have so many research going on, clinical trial going on right now to develop TB vaccines for adults. where we can take, just like we are trying to develop malaria.
Dr. Olushola Shokoya, Director and Program Manager, State Tuberculosis, Leprosy and Buruli Ulcer Control Program Unit, Ministry of Health, Lagos. We want to thank you so much for joining us on Insight, and thank you for educating us. Thank you very much.